Good afternoon, everyone. Thanks for joining us. As you can see, I'm joined today by the Chief Nursing Officer who will assist me with questions shortly. But firstly, let me run through the latest statistics for you as usual. The number of positive cases reported yesterday was 1,149. That represents 4.9% of the total number of tests and means that the overall number of confirmed cases is now 183,418. Now, as you've heard me say many times before, we should never read too much into a single day's figures, obviously. But that said, any day with test positivity below 5%, particularly given the phase of the pandemic we're in right now, is welcome. And today is the first time we've had that in more than a month. So we shouldn't overstate it, and I'm going to stress that point. But nevertheless, I think, particularly given how grim things have been recently, we should allow ourselves to reflect just a little bit on the rays of sunshine when they appear, and that is undoubtedly a small ray of sunshine. Now, of today's new cases, 339 were in Greater Glasgow and Clyde, 190 in Lanarkshire and 159 in Lothian, and the remaining cases are across 9 other health board areas. 1,812 people are currently in hospital, which is 53 fewer than yesterday, and 127 people are in intensive care, which is 4 fewer than yesterday. So again, we are starting to see the numbers in hospital and intensive care stabilise and start to decline, albeit gradually. And again, that is positive news, although those working on the front line of our health service continue to be under very severe pressure. However, I am sorry to report that 53 additional deaths have been registered in the past 24 hours of patients who tested positive over the previous 28 days, and the total number of deaths under that measurement is now 6,322. As we start to see case numbers and numbers of hospitalised and patients needing intensive care decline, obviously it takes longer for the numbers of people dying to start to decline as well. And we should therefore remember that even although we might be starting to see some positive signs in the statistics, there are too many families across the country still losing loved ones. And I again today want to send my condolences and my thoughts to everybody who is grieving, particularly those recently bereaved, but to everybody who has lost a loved one in the course of the pandemic. Now, later today, we'll be publishing as well the latest estimate of the R number. I'm pleased to say that will show that the R number remains below 1, which is further evidence of the progress we are making. However, for all of that positive progress, it's really important for me to stress that if we are to maintain that progress in suppressing the virus, it is essential that all of us continue to follow the stay-at-home except for essential purposes rule. That is really vital. It's all of us doing that is leading to this positive progress. And the infectiousness of the virus, especially the new strain that we have been dealing with for the past number of weeks, means that progress could very easily be reversed if we start to drop our guard prematurely. I want now to turn to the latest data on vaccination. As we suppress the virus, of course, in this other lane of the race we've spoken about is the vaccine programme. As I have reported already, we have now vaccinated with the first dose 98% of older residents in care homes, and 89% of staff working in older people's care homes have also now had the first dose of the vaccine. And let me be clear, these are not figures for people offered vaccination, these are people actually vaccinated. These are quite extraordinary uptake numbers, and they are hugely important given the toll the virus has taken on older people in care homes. I can also report that as of this morning, at least 90% of those aged over 80 and living in the community have been vaccinated. The work being done, which I've referred to already this week, to refine the total number of people in that over 80s in the community group of the population actually suggests that that percentage in reality is higher than 90%. And again, the importance of protecting such a high number of older people most vulnerable to this virus can't be overstated. However, and you've heard me say this as well, targeting maximum uptakes in these most vulnerable groups does take time. And that has meant that overall numbers vaccinated in Scotland have been slightly lower so far. That's been subject to criticism, It's fair enough for people to do that, but it has been about trying to protect the maximum number of lives, and I think that is important. However, I'm pleased to report that having achieved such high uptake in the two most vulnerable groups, we are also now seeing the pace of the programme overall pick up significantly, as we always said it would. So as of 8:30 today, I can tell you that a total of 694,347 people have received the first dose of the vaccine. That is an increase of 45,085 from the number we reported yesterday. And that daily total of more than 45,000 is the highest daily total we've recorded so far. In fact, this is the third day of a record high daily total. And today's is 52% higher than the same day last week. So if we look at this week so far, we vaccinated 55% more people than in the same period last week. So that gives you a sense of the acceleration that we are now seeing in the pace of the programme overall. Now, the overall number that I've just reported there now also includes 38% of 75 to 79-year-olds living in the community. They've also now received the first dose, and we will see that number rise rapidly over the days to come. And we are on track to meet the target we set of all over 70s and all adults classed as clinically extremely vulnerable by mid-February. Indeed, many over 65s are also now receiving the vaccine. So in short, the vaccination programme in Scotland is going well. It has been focused on protecting those most vulnerable first, and that's important, and then working as quickly as supplies allow through everyone else. And I want again today to take the opportunity to thank everyone who is working really hard across the country to achieve this. But I also want to thank you, the public, those of you in the groups that have already been prioritised for vaccine, for coming forward in such large numbers so far. The uptake rates we're seeing, and I hope this continues as we get into the younger population groups, are way beyond anything I could ever have believed would be possible, way beyond what we see in the flu vaccine programme. So that is testament to the willingness and the enthusiasm, I would say, of people to come forward, be vaccinated for their own safety, but also to be part of that collective effort that we need to have to beat this virus. Now, as we vaccinate more and more people, it remains vital, I said this earlier on, that for the moment we do stick with the lockdown restrictions. They are necessary, and I think as we are seeing now in the data, they are working. I said earlier this week that we will keep these in place until at least the end of this month because they are so necessary. But I know they are really hard for everyone. So the two other issues I just want to briefly highlight today relate to support for businesses and some support and advice which is available to help individuals and families. In relation to businesses, as many of you know, the Scottish Government set up the Strategic Framework Businesses Fund to help many of the hospitality, leisure and retail businesses that have been required to close. In December, as we brought tighter restrictions into force, we announced top-up funding for those businesses in addition to the monthly grants that they are receiving. This top-up support is worth £25,000 for larger hospitality businesses and £9,000 for larger leisure and retail premises. The reason I'm highlighting this support today is that for businesses on the mainland, there's slightly longer timescales to apply for the Special Islands funding, but for businesses on the mainland, the deadline for applying for these top-up grants is tomorrow. Now, let me be clear, if you are a business that has already applied to the Strategic Framework Fund, you don't need to reapply. If you're currently receiving monthly payments, you will get these top-up grants automatically. But if you are eligible for support from the Framework Fund and you have not yet applied, then please do so. Otherwise, you risk missing out. You can find details about eligibility and about how to apply on the Find Business Support website. And even if you don't qualify under the Strategic Framework Fund, the website can help you find details of other programmes that you might be eligible for. Now, the second and final point I want to highlight relates to mental health. This week is Children's Mental Health Week. It takes place in early February every year, but this year, of course, it's more significant than ever. The last 11 months have been really difficult for all of us, but I don't think there is any doubt that children and young people have borne a really big burden from everything that they have had to do to help us deal with this virus. They've had their schools closed, their education disrupted, and of course they've been unable to see, play with, interact with friends as normal. So I want to highlight today some resources that are in place to help children and young people at this time, because I know lots of children and young people will be struggling right now, including struggling with mental health. So, for example, the organisation Place to Be, that's Place to Be with the 2 written as the number 2, has created a range of free resources. These are designed to help children find creative ways to share their thoughts and feelings. They're able to be adapted for use in school when we start to return young people to school, or for learning from home, or for independent learning for young people. In addition, the Young Scot campaign, I Feel, I being the Scottish use of the word I for yes, I Feel, has useful information. The Parent Club and Clear Your Head websites also provide good advice, including about how to support children's mental health. And the Clear Your Head site can also help find lots of other possible sources of support. The well-being of children is a priority. I know it's a priority for the parents, grandparents, aunties and uncles who'll be watching this, but it is a priority for the Scottish Government. It's why we are and we will continue to prioritise a return to school, albeit a phased and careful return to school, ahead of easing lockdown in other ways. There may be points in the weeks to come where adults are asking me to open pubs and restaurants and open the places that we as adults enjoy going. And there may be a period where I'm saying we can't do that yet. And the reason we can't do it is because we need to keep all of the flexibility we have to get children back to school. And when we get to that stage, as I suspect we will at points over the next few weeks, please remember that that is the priority of the government, the well-being and the education of children. And I know it's one that is shared across the country, but it will demand of adults a bit of patience in the weeks to come. So please, for adults, remember that this is a tough time for you too. There is help and support out there, and the See Me National Mental Health Campaign is today designated this day as the Time to Talk Day. One of the things they are pointing out is that often when people are feeling down and struggling with things, often a small gesture, phoning up somebody or sending them a card, can make a big difference. So if you're in a position to do so, then maybe think about whether you can reach out to somebody today or later this week. And if you're feeling down yourself, remember the NHS Inform website. It's at nhsinform.scot/mind. It has lots of information, and you can call NHS 24 on 111 as well. So my point today is this is tough. We're 11 months into this pandemic. We've still got some tough times ahead of us. Everybody is struggling. It's affecting all of us in different ways, but it is affecting all of us. So if you feel you need some help, please reach out, and remember, be kind to each other. Let's all try, as we have done throughout these last 11 months, to continue to support each other as much as we can. And finally, let's keep focusing on the light at the end of the tunnel. We're not quite at the end of the tunnel yet. There are still some tough times ahead. But there is no doubt that the light is more visible now than it's been at any point in recent weeks. You see that in the figures. Case rates are falling. Numbers of people in hospital and intensive care are starting to fall. Vaccination is accelerating. Now, we've got more work to do. We need case numbers to get to a lower level. We need to get them as low as we possibly can, but we're making progress. So let these trends give us hope for the future, and from that hope, let's all draw the strength we need to keep going right now and stick with it. Please continue to stay at home except for essential purposes. When you're out and about, make sure you're following all of the facts advice to keep yourself and each other safe. Stay at home, protect the NHS, save lives. That's the mantra that is serving us well, and it's the mantra, if we all stick to it, that will get us through these next few weeks. Thank you very much indeed for listening. Now, Fiona McQueen is with me today, but we're going to move straight to questions now, and Fiona, of course, will help me answer the questions. But if I can call firstly today on Katie Hunter from the BBC.
Thanks, First Minister. Can I ask when you expect to see the impact of the vaccination programme in terms of easing pressure on the NHS? And also a quick question about the weather. Are there any concerns that snow could impact on vaccine supplies getting to certain parts of the country, or indeed people making their appointments? And what preparations, if any, have been taken place given the forecast?
I'll hand over to Fiona, who will also maybe want to reflect on when we might see an impact of the vaccination programme on case numbers, hospital figures, etc. I think it's hard to be really definitive about that because we don't yet know exactly what the impact of the vaccine is on transmission. So we know it suppresses illness and hopefully death. There's still more doubt, although we had some good indications this week in terms of the Oxford vaccine, that it does have a positive impact on transmission. But we don't know whether it stops you getting or passing on the virus. And this is why we have focused so much, not just on starting with the most clinically vulnerable groups, but maximising uptake there. We would hope that in reasonably short order, we would see the 98% of care home residents, the oldest care home residents being vaccinated, start to have a positive impact on their propensity to become very seriously ill and die. Similarly, in the over 80s group. So I would hope we would see that impact on hospitalisation, on intensive care, dependency, on the number of deaths start to feed through in the weeks to come. And longer term, or hopefully when I'm saying longer term there, I'm meaning a reasonably short longer term horizon, we start to see a greater impact on transmission as well. But we've got to be cautious. I think now, we talked a lot last summer about caution. We were very cautious. There are perhaps things we should have been more cautious about, international travel being one of them. But right now, we really need to be cautious and not squander the progress we've made. Give this vaccination programme as much time and as much opportunity as possible to do what it needs to do before we start to ease up too much and risk reversing our progress. Fiona might want to say more about that. On weather, I've just been having a discussion before coming in here about concerns about weather over the next few days. Yes, I am. I'm always concerned when there is severe weather forecast, but obviously we want people to be able to get to vaccination centres, and forecasts and reports of heavy snow clearly concern me and make my heart sink a little bit. But as part of our resilience preparation and local authorities resilience partnerships are in the lead here, there's lots of work going into making sure gritting and snow clearing where necessary so that we keep the vaccination programme running as smoothly as possible, even when there is bad weather. But of course, logic and common sense tells you that severe weather does have an impact on these things. We just have to try and minimise that as much as possible. The Deputy First Minister will be leading the briefing here tomorrow, and part of his ministerial responsibilities is overall oversight of this weather resilience, and we'll be able to say more as we see exactly what the weather forecast, how it materialises into reality tomorrow. But it is something that's very much on our minds at the moment. Fiona?
Yes, certainly. Thanks, First Minister. As everyone knows, winter is a time of pressure for the NHS. So even without COVID, we would have increased pressure, whether it is slips on the ice or whether it is in particular respiratory illness. We have been very fortunate this year not to see a high prevalence of flu circulating. So that has made a real difference in terms of holding the pressure within the NHS. So the pressure that we're seeing now with people who have COVID is interesting in terms of younger people than the first wave are in our hospitals. Because our clinicians have better access to treatment, we know and understand more about the illness and how to successfully treat people. That's meaning people, fortunately, are living, but also are in hospital for longer. So there is a strange difference between this wave and the first wave in terms of the pressure on the NHS, and the new variant, which is more transmissible, is meaning that although our rates are coming down, we think the impact on the NHS is still going to stay for some considerable time in terms of that length of stay, the younger population, and of course the older population we're now protecting with the vaccine are in a relatively sheltered environment at the moment. So 21 days after the first immunisation, so for many people in care homes, that will be here. That's then when it shows a good good result. We see good numbers of antibodies, and that then, from the research and the trials, evidences reduced severity of disease and reduced death. So we should begin to see that ticking in from now. And that, of course, will help in terms of the pressure of the NHS. It of course, is much better because people are becoming less ill. So we would expect to see that. We need to encourage everyone, of course, if you're called, to come to the vaccination centre. And if I could say a bit, please, to people who are coming to the larger vaccination centres about some of the processes we see. Some of these vaccination centres run from 8 till 8 at night. They see large volumes of people, and there are many people who are vaccinating there, and we're very grateful to them and all the support staff who are doing an amazing job. If you're there at the end of the evening, you may see a number of vaccinators not actually vaccinating, and I would ask you to be patient, because people will have heard of wastage, and there's an industry norm of 5% wastage being acceptable. In Scotland, we're wasting less than 2% of the vaccine. But if you draw the vaccine up, then you'll administer it. So if a nurse or a vaccinator has 10 doses to administer, they then personally have to give that vaccine. So you may see at the end of an evening vaccinators who don't have vaccine to vaccinate, and perhaps a smaller number to do that. And I would ask you to be patient. You will be vaccinated if you turn up at the vaccination centre, but at the end of the evening you may think that there are some people who are not vaccinating, but actually it's about us balancing the amount of vaccine that we have with the people that we have there. So we should begin to see, it's early days, but we should begin to see that reduction in death, that reduction in severity of disease in the coming weeks.
Okay, thanks, Fiona. Louise Scott from STV.
Thank you, First Minister. A new study from Aberdeen University has found international travel showed the biggest impact on increases in death rates in the first wave. You've said mandatory quarantine will be in place for all international arrivals to Scotland, but when is this likely to begin? Do you have a proposed date, or can you even give us an idea of a timeline you're working to? And given the findings of this study, is it likely that managed quarantine will be in place long after lockdown is eased?
I can't give you the specific date just now. As I said in Parliament this week, we've got some quite significant practical arrangements to put in place to support managed quarantine, but we are working through that as quickly as possible, and we hope to introduce this soon, and we'll give more detail of that hopefully over the course of next week. We, as things stand at the moment, are intending to have a much more comprehensive system of managed quarantine than is currently planned for other parts of the UK, although I suspect we may see this moving in future. I would say, though, just because that system is not in place right now doesn't mean that we don't have very stringent travel restrictions in place. You should not be travelling right now unless it is essential. That applies within Scotland, it applies from Scotland to and from other parts of the UK, and it applies to overseas travel. So do not be booking holidays right now and don't be travelling unless it is really, really essential. So the numbers travelling, the numbers requiring managed quarantine, if everybody's abiding by the rules, should be small, but it will be, particularly as we continue to suppress the virus within our own borders, it will become an additional very important layer of protection, particularly given we now have a virus that is mutating, because we don't want, if we can possibly avoid it, new strains coming into the country. But we'll set out more details of how that is going to be operationalised just as soon as possible. On the question about the longevity of this being in place, again, I'm not able right now to give an end date. We don't want any restrictions like this to be in place longer than necessary, but they have to be in place for as long as required. Part of the, and again, we've got to get our heads round this, I think, collectively as a country. When you're dealing with a virus like this, and we learned some of this last year, as we came out of lockdown in the summer, we can't do everything because the virus will overpower us if we try to open up in every single respective life. So we have to make choices. Now, in Scotland, the choice the government is making over these next few weeks is children first. Pretty bluntly, children first. So schools, getting children's lives back to as much normality as possible. That's our priority. And if that means the rest of us can't go for a pint in the pub or a meal in a restaurant for a bit longer, that's going to have to be the case, and we of course continue to support the hospitality industry in that. But those trade-offs apply in other ways as well. So as we start to get more normality for the rest of us at home, to see our loved ones a bit more, to have some more normality in life, the trade-off for us then is going to be not going overseas, or not having people coming from overseas into the country without that managed quarantine. And that's difficult, but that is, how do we get, if you look at, and comparisons with New Zealand can be important, but they can also be taken too far. New Zealand is different to Scotland because its geographic position is very different, obviously. But in New Zealand right now, there is pretty much, not normality domestically, but the price they're paying for that is a ring of steel around the country. People not coming in and out of the country. So we might not be able to go to exactly the same position as other countries in every respect, but if we want greater normality at home, for a period, we're going to have to accept the trade-off of not having overseas travel. How long for? I don't know yet, but what I do know is the more successful we are in suppressing, the more successful we are in vaccinating, the sooner we get out of this. But it's a global pandemic, so getting out of it doesn't just depend on us doing all these things, it depends on the whole world getting itself into a better position as well. Peter McMahon from ITV Border.
Thank you very much, First Minister. First Minister, ITV Border has been speaking to people who've lost close relatives to COVID, a wife, a father, for example. Now, those people are still looking for answers. They want to know what happened, why it happened, why they lost their loved ones. You and your government have promised a public inquiry. Holyrood voted for an immediate public inquiry in November. As care homes are now, residents are now being vaccinated and eventually fairly soon get the second jag, can you now give some hope to those people and order that public inquiry?
Often, Peter, and this is not a criticism, the simplicity with which these questions are posed just can't be the simplicity with which they're answered. There is going to be a public inquiry. I think we're so far the only UK government that's given that very clear commitment. It will look at all aspects of the pandemic, but care homes and what happened in care homes is a specific part that has to be looked at. No part in my now more than a decade of being in government, when I was Health Secretary, have ordered public inquiries in the past. They take time to set up because you have to prepare the remit, you have to get the judge who's going to do it, you have to put all of the other arrangements in place. Now, there is early work being done on these things, but there will be a public inquiry. But we are still in the grip of a second wave of this pandemic. And as First Minister, I have to balance wanting as much as anybody to have that scrutiny and accountability and people getting, to the extent that they will be able to get answers. It may be that none of us get all of the answers about COVID that we would like to get. I want that as quickly as possible. But I don't want, one of the things that public inquiry is in time looking at is why we took our eye off the ball in the second wave and didn't do everything we could to minimise the impact of that. And, that is not to say lessons are not being learned. I, have spent a lot of time this week explaining why, our focus on maximising vaccination in care homes might have meant a bit of a slower rollout in the initial stages elsewhere in the vaccination programme. The death toll in our care homes, not just Scotland, but I'm only responsible for Scotland, in the first wave of this pandemic, and it's nothing like what I'm about to say as it is for families affected. But that will be engraved on my soul for the rest of my life, that pain and suffering. And I want to make sure we are doing everything we can, learning all of the lessons of the first wave to try to minimise the impact in the second wave. That's one of the reasons why we have put so much effort into getting the maximum numbers of people vaccinated. So we're learning lessons as we go, but we have to keep focused on the here and now. Otherwise, more people will die in the second phase than is absolutely necessary. So there will be a public inquiry. It will be as soon as we can make that be, but it will not be and cannot be at the expense of focusing everybody's efforts on getting us through what we face right now. Rupert Evelyn from ITV.
Thank you very much, First Minister. Clearly, I think everybody will be delighted to hear that you've finally caught up with the rest of the, or appear to have caught up at least with the rest of the UK in terms of vaccination statistics now. But there are still an awful lot of people who are left behind, aren't there? How do you help those, for example, like the 85-year-old man we've spoken to today, who still have no idea when they're going to get their vaccination?
If you've got an 85-year-old person, please send the details to us. 90%, more than 90%, 90% is based on our original estimate of the numbers of over 80s living in the community. We actually think we overestimated, so the percentage vaccinated is now likely, we think, to be well over 90%. There will still be, in any big programme, there will be individuals that for one reason or another might get missed. There should be very small numbers, and the final target date for vaccinating all over 80s was tomorrow, in fact. So if you have an 85-year-old, pass the details and we will look into getting answers as to why they don't know why they're being vaccinated. But the vast majority, over 90% of over 80s are vaccinated already. Now, you know, you talk about, and I accept this, I'm fighting a losing battle in terms of trying to convince people that the lagging behind is not just a slowness of getting the programme. We've made a decision in Scotland to prioritise vaccinating, not just offering vaccine to the most vulnerable groups, but actually making sure we are delivering the highest possible uptakes in these priority groups, care home residents and over 80s. And our uptake rates, I can't say this with certainty because I'm not sure what the situation is in Wales and Northern Ireland, but England haven't published percentages for care home residents vaccinated. I suspect our uptake rates in these groups will be higher. Now, that has meant that we haven't gone for overall volume in the way that others have, but the reason for that is that we have been concentrating on the most vulnerable. But we are now catching up on the rest because, as you can see, the acceleration in progress. Now, as I said in Parliament this week, people can decide whether they think our approach is right or wrong. They can decide, nah, you should just have gone for overall volume and make sure your overall numbers kept pace. But this is a virus that affects older, frailer people most. And it's a vaccine that we know right now has an impact on illness and death. So take these two things together, and I think it is right to make sure we are using it in a way that gives maximum protection. But we're not in that trade-off now. We're motoring through the other groups, and we'll continue to do that at the pace that we are now setting. This week, I don't know today because the figures for other parts of the UK won't be out till later, but if we take the last 2 days, we're not just vaccinating more compared to last week ourselves, but the vaccination rate in Scotland is about 30% higher in the last couple of days this week so far than in England. So that catch-up is there. But don't forget, whether you agree with it or not, all I'm asking people is to understand the way we've gone about this programme and the rationale behind the decisions we've taken. Alan Smith from Bauer.
Thank you, First Minister. There was a bit of discussion this morning at the Holyrood's COVID Committee about the mid-February target for over 70s receiving their first dose and what constitutes as being mid-February. Is there a specific date that you're working towards to have over 70s having their first dose? And a question for the Chief Nursing Officer, if I may. In recent weeks, we've heard from medics, the BMA and the RCN about PPE who believe that the current guidance just isn't strong enough for staff. And today there's a study from Bristol University which suggests that NHS workers surrounded by coughing patients are at a much greater risk of contracting COVID than first thought. Can I ask when was the last time that the Chief Nursing Officers from across the UK discussed the PPE guidance and what is stopping you from perhaps taking a more cautionary approach?
I'll hand over to Fiona on the PPE point in a second. For me, firstly, the date we've used, I think we've said this publicly before, but forgive me if we haven't, for mid-February is the 15th of February as an approximate mid-February date. But I want to make a point about all of these target dates we've set, and it's a point I was making in a meeting I had yesterday with all of the chief executives of our health boards, is that these are dates that we give that are they're not intended to be, when we say to health boards delivering this programme, we want all over 70s vaccinated by the 15th of February, we're not saying you've got until the 15th of February to do it. We're saying that is the absolute last point. We want you to do it as quickly as possible. So to be working in a way that hopefully is exceeding, not just meeting those targets. So that's the way in which the programme is working right now, maximising the daily throughput to get through people as quickly as possible, now that we've got those really high uptakes in these two top priority groups. So that's the way we are proceeding now, and obviously the daily figures that we publish will allow people to track how successful we are being in that. But I'm heartened by the last few days' figures, and I know the planning that is going on across the country to make sure that that pace continues.
Thanks. So the Chief Nursing Officers, we meet every fortnight. We're meeting again tomorrow, but also the Chief Nursing Officers and Chief Medical Officers and other specialists from Public Health Scotland, Public Health England. We meet every week, and we met on Tuesday this week, and we discussed infection prevention and control measures. In particular, what we call the FFP3 mask for protection. So I've asked Professor Jackie Riley, she chairs a nosocomial review group. They meet every fortnight. They've been meeting throughout this pandemic, and they give us expert advice in Scotland, and they contribute to an overall United Kingdom approach to infection prevention and control. And this paper that you're referring to in terms of the additional coughing from patients has been studied by the nosocomial review group. They will also look at it again on the 8th of February, and the notes and minutes of these meetings are published on our website. And we do a number of things to protect our staff and our patients. Clearly, good infection prevention and control, so the fluid-resistant surgical mask and the FFP3 mask, they both provide about 20 times more protection than no protection. So they are of equal value for the droplet type infections that come from coughing. And therefore, the specialist expert advice is that both of these masks are equally effective, so that fluid-resistant surgical face mask provides the same level of protection to our healthcare workers. On top of that, as you know, we've vaccinated our frontline staff who interact with patients. We have twice weekly testing for them, and also testing for our patients on admission. So we have a number of interventions that we've put in place to protect our staff. So we understand that the BMA in particular, I'm not so sure that the Royal College of Nursing in Scotland has that as significant a concern, but we're having webinars, we're having dialogue with them, so we can really understand what the concerns of staff are and how we can best wrap around and support them to do the amazing job that they're doing day in, day out.
Thanks, Fiona. Jamie Saunderson from Original 106.
Thank you, First Minister. Touching again on the study from Aberdeen University around international travel, you've already admitted that not enough was done last year to restrict travel from outside. But can you explain why the decision was taken at the time not to impose measures such as border controls and quarantine hotels, given that these are now being considered? And secondly, we've been speaking to Professor Linda Bald, who believes the vaccine rollout and increased community testing means that we can be optimistic about the summer if things go to plan. Do you share her optimism?
I hope today you will have detected from me a degree of optimism in my opening remarks. I always try to balance that with realism. I've tried from day one of this not to give people false hope, to be quite frank, that there are uncertainties. There are, as we know, this virus has served as lots of curved balls along the way, particularly the new variant just before Christmas. So I don't want to stand here ever and sort of give people that false hope and promise the earth and then decide that things haven't worked out that way. So I try to take things pretty much as we see them just now. There's a lot of reasons to be optimistic looking at the state of play just now. We know case numbers are coming down, test positivity is coming down, and therefore we're now starting to see the dip in hospital cases and ICU cases. On the other side of that, I would still like to see case numbers fall more quickly and to a much, much lower level. They are still, right now, case numbers are lower than they were at the start of the year, but they are still higher than they were in the week before Christmas. So we've still got a way to go, and that means we really, really need to stick with this and drive it further down. We need to get it. I know there's some debate in sections of the media today, I think referring to England, but it's relevant to Scotland as well, about should we just be trying to protect the NHS and then get things back to normal, or should we be driving rates of infection as low as possible before we open up? I'm in the latter camp, because we know from past experience that if we open up too much when infection levels are still quite high, it quickly can run out of control again. So I'm in the very much the elimination camp of this, get it as low as we can to open up as much normality and give us the best chance of controlling it through much targeted means. We got very close to that in the summer, and then international travel set us back again. Now, it's not the case that there were no restrictions on travel. You know, we had quarantine or self-isolation requirements for certain countries, but I think we should have gone further, and I don't want to repeat that. Now, there are reasons why we didn't take the decisions. Some of them, and I'm not trying to pass the buck for the decisions that were mine, but travel is complicated across the island of England, Scotland and Wales, with Northern Ireland and the Republic of Ireland because of the common travel area. As we will find out on managed quarantine, if it is the case that Scotland is going much further than England goes, there will be practical constraints there. People coming into the country to Heathrow and then travelling to Scotland, for example. So sometimes we have perhaps not taken decisions because we thought doing these things on our own wouldn't be effective if we couldn't do them on a four nations. And there is still some truth in that, but I've decided to kind of err on the other side this time and do as much as we can ourselves while we try to encourage more of a four nations approach, even although I have to recognise that there will still be some weaknesses there if it's not four nations. So, you know, I've tried my best to get these decisions right as we've gone along. I've tried to learn as we've gone along. I can't turn the clock back, but none of us have been infallible in this unprecedented situation. And I think for somebody like me in that position I hold, the most important thing is that we try not to repeat things that we look back and think, you know what, we wish we'd done that better, that we learn and do them better in the future. So that's what we are seeking to do. Do you want to add anything?
I think the First Minister says that the main thing that we can do to protect the NHS is to reduce infection to the lowest possible level. I think the other aspect is if we're sitting in around a middling type of infection, what that does do is it allows new variants to take hold. And what we need to do is get the rate of transmission down to as low a level of infection as possible, get as many people vaccinated, and then we'll be able to start moving around more freely, because the risk of new variants is too high, where we're still having a level of transmission within the community that isn't comfortable. And as we've seen with this wave, the NHS has been under more pressure than it was through the first wave, even although we're not having quite as many deaths and inpatients. So I think it's important for that measure alone.
Thanks. Neil Pooran from PA.
Thanks, First Minister. You mentioned earlier this week the expansion of asymptomatic testing in the community. Will it be the Scottish Government or the local health teams that decides exactly where this is taking place? And will there be a national standard for how many of these asymptomatic tests you want to do, or whether they will be PCR tests or lateral flow tests? And also just wondering if you could maybe update us if there's been any further developments around the South African strain, if that's been any more cases of that have emerged in Scotland.
So on the first point, I think I said this in Parliament, by the end of this week we'll have approved proposals for asymptomatic community testing in a majority of the mainland local authority areas in Scotland, and we'll set out details of that when we've got these final approvals. And in terms of the questions, so these are proposals that have been put to the government for approval by local health teams, local authorities, local health boards, and they will be a mixture of size depending on the communities they're serving. As was the case in the pilots before Christmas, there will be a combination of lateral flow testing and PCR testing being used in the pilots before Christmas. Any positives that came from lateral flow testing also had to be verified and confirmed through PCR testing. So there are standards in the sense that the Scottish Government has to be satisfied that the proposals are robust, that they are sensible, that they're going to meet all of the standards that people can expect for the way the tests are carried out, but they will vary in shape and size depending on the communities that they serve. But once these plans are all finalised, we will of course give more detail of the nature of them. And your second question has just gone out of my head. What was it?
On the South African variant.
On the South African variant, my apologies. No, I have no further information updating the information I gave to Parliament this week, which was to date there have been 5 cases identified in Scotland, all with associations to international travel. So that's important because that allows us to be assured at this stage, and I'm stressing at this stage, that there's no onward community transmission of it within Scotland. This information has to be verified through genomic sequencing, obviously, so it takes a bit of time for these cases to be identified, and it may be that we will, in the days to come, have numbers higher than 5. But lots of steps have been taken to try to contain and control and avoid onward transmission of this variant. Dan Sanderson from The Telegraph.
Thanks very much, First Minister. You spoke the other day about possibly some limited easing of lockdown restrictions from early March. I just wanted to check, do you envisage that being, nationally, or might we go back to the level system? It's just, looking at the data, that there is now quite a wide variety in case numbers in different parts of the country. And also at the COVID committee this morning, there was a bit of talk about the Lancet paper on the AstraZeneca vaccine. Now, if those findings are verified around, less transmission and less hospitalisations, is it realistic to think, we might get something approaching normality by the summer? Obviously, accepting that the travel restrictions you've spoken about will remain in place. Thanks.
Thanks, Dan. You remain very optimistic that I find and bring to these briefings a crystal ball that I just don't have. I mean, my honest answer to both of those questions is I don't know at this stage, and I wish as much as you wish, no doubt, that I did know. So right now, I hope that as we get to the early part of March, we can look towards some probably gradual easing of lockdown restrictions, but I can't say right now that that's either definite or exactly what form that will take, or whether it will be national or regional. We do hope at some point to get back to the level system where we don't have a one-size-fits-all, but whether we'll be able to do that as soon as March, right now I just don't know, and I'm not going to, I've tried to avoid doing this, of speculating too far into the future and giving people hope that might end up not to be realised. But things are going in the right direction, and that's the thing I think we've got to take heart from, but also stick with it so that we keep it going in the right direction. The one thing I will repeat, which I've said already, is that as we do start to ease lockdown, certainly in the early stages, all of the limited room for manoeuvre that we think we have will go on children and getting children back to normal first. So it may be that for a bit longer, the rest of us, the adults, will have to make sacrifices in order to allow that to happen. And similarly on the Lancet paper on the AstraZeneca Oxford vaccine, again, I can't say that with any certainty. I certainly can't look right now to the summer and say, yeah, we'll get normality back by the summer. It wouldn't be fair to people for me to say that, because I have no basis on which to say it right now. But again, with that, all of the signs we're seeing right now are hopeful. The early indications from the Oxford vaccine are not just that it is very effective in doing what we thought it would do, but it is also having a significant impact on transmission. Now, there needs to be more data. There needs to be much more solid understanding of that before we can draw firm conclusions. But, everything right now is on the optimistic, hopeful side. And we've got to cling to that. But to keep us there and keep us going down that road, we've got to be very, very cautious. If we think back to last year, we were in a difficult phase in early December. We knew we were going into a second wave winter period. But the new variant absolutely came like a punch in the stomach. We didn't think we were going to have it as tough as we have had it. And that kind of came out of the blue. You know, everybody's known the virus would mutate and we would get new variants. But at that point, a new variant, so much more infectious, knocked us for six. None of us can be sure that something like that won't happen again. And that's why we need to be really cautious that we're doing everything we can to minimise the risk of that while we start to see some of these more hopeful signs take firmer root.
I think the First Minister said children and young people are our priority. Now, our younger ones we're hoping will be back after mid-term. We need at least 2 to 3 weeks to evaluate what impact that had on transmission within the community, and therefore stepping back slowly means we need the time to assess the impact of lifting some restrictions and getting our children and young people back into education. Both the Pfizer and the AstraZeneca vaccines are good. They're solid, the vaccines, and we have confidence in the evidence that's been presented through the trial process. And of course, the article in the Lancet has supported that, and it has given us even more confidence that the vaccines are going to do the job they need to do. But if I go back to my last comment about the mutation, what we can't afford to do is protect our older and more vulnerable population and say, well, our young ones actually, they can, the vaccine, the virus is fine with them, they don't have much in the way of illness or serious concerns about that. But actually what it does do is allow mutation. So we do need to be very circumspect about reducing the virus to the lowest possible level so that our whole community can be safe.
Rachel Watson from the Daily Mail.
Thank you, First Minister. I just wanted to ask about lockdown again. It's been suggested by UK ministers and scientists that there won't be a significant easing of restrictions until all the over 50s are vaccinated. Is that what your thinking is? And also you mentioned getting the levels of the virus to the lowest levels possible before reopening. When you talk about that, are you talking about trying to suppress the virus more than you did last year before you tried to reopen? Or will you be going by the kind of same figures and R number rates that you did last time?
I'm not going to put specific figures on all of that. We suppressed the virus, as we now know from the genomic sequencing reports, to a very, very low level last summer. So if we can get it back to there, that would be fantastic. And then we need to do better at containing it after that than we did last summer. So let's focus on that. Reopening, as we found last summer, it's not a binary thing. It's not a one day we're closed down and locked down, the next day we're open. It will be phased as it was last summer. We may make different choices in the phasing. I've already said children first. So that may mean things that opened in the sort of first stages of coming out of lockdown last year take a bit longer this time. So we just have to be careful about that and err on the side of caution. Last year's showed us we were cautious in a relative sense compared to many others last year, but perhaps we should have been even more cautious, and I think we've got to learn that lesson this time. Similarly, in terms of opening up, and remember it's not a binary overnight thing, getting the virus to as low a level as possible, and we'll make judgments about what that actually looks like as we get there, getting as many people vaccinated as we can. So it's the combination of these two things. So I'm not saying we're not going to open anything up until we've got all over 50s vaccinated, but the more people we can have vaccinated, coupled with the lower we can get the virus to, the more we can start to look to open up, albeit gradually. So both of these things, it's the race analogy that we've used so many times before. Slow the virus down as much as we can right now. That's still where, the real burden of this lies on all of us, and speed the vaccination programme up. Now, we're doing both of those things right now. We need to do both of them even more. And then over the weeks to come, we'll have judgments to make about, can we open this up? Can we open that up? How much opening up can we bear given the overall situation we face? What's the scenarios with new variants? Is that posing risks to us? These are really complex judgments that I don't have a magic formula for. We will try to make them as carefully as possible, and regardless of the complexity associated with them, I'll try to explain them to people as straightforwardly as I can. Dan Vevers from The Sun.
Thank you, First Minister. Just two brief vaccine-related questions. You said this morning, and you pointed out again here, that vaccination rates in Scotland were around 30% higher on Monday and Tuesday than in England. But looking at vaccination rates per head of adult population, we're also worse than Wales and Northern Ireland. So why are you choosing England to compare to? And secondly, just quickly, last week, the World Health Organization called on wealthy countries to pause their vaccine rollouts once the most vulnerable have had it, to ensure a fair distribution of vaccines around the world. Would you be prepared to do this? Thank you.
We've got a vaccination programme that's focused on vaccinating the whole adult population, and that's what we will be working towards. But I think it is really important that all of us recognise that we will not make ourselves safe, and I'm talking here UK, just by having everybody in the UK vaccinated if the rest of the world is still not. This is a global pandemic, and therefore I do think it is important that countries, richer countries, countries with greater access to vaccine supplies, do think about how we share those equitably across the world to make sure the world is properly protected. Because the way out of a global pandemic is for the world to get out of it. Nobody's going to come out of it completely unilaterally, and I think that is an important point. Why do I keep comparing myself to England, Dan? Because that is what you, not you personally, but you in the media have been comparing us to over the past couple of weeks on vaccination. So I'm not, yes, we all talk about comparisons, and let's not blame each other for who's responsible for that. At the end of the day, my responsibility is to make sure Scotland's doing everything that we should do. That's all that matters. So it doesn't matter really to me if we're doing better than England if we're not doing well enough. But I've made those comparisons because those are the comparisons that have been getting put to me. And I've tried to explain the reasons for them. But because those comparisons, even when I explain the reasons for them, still get put to me, this week I've been saying, well, actually, what you were saying last week is not true this week. But at the end of the day, my focus is on making sure that the Scottish vaccination programme goes well. And the governments in the other nations of the UK, I know, are as focused on that as I am in their own countries. Paul Mallock from the Courier.
Good afternoon, First Minister. We've been told that community vaccine centres in Afford and Ellon in Aberdeenshire have been closed at short notice, with appointments being relocated to the Mass Centre at the P&G Live in Aberdeen. NHS Grampian have said that they have felt pressure to do so to consolidate staff to hit their new jab targets. Is this a measure which will be replicated across the country, with smaller community centres being shut to relocate staff to the mass centres? And with that in mind, have you carried out, or has the Scottish Government carried out any research on what impact this could have on uptake? These are rural areas with public transport and roads which are heavily impacted by weather, currently by the snow. Is there a risk that by sacrificing these community centres, fewer older and more vulnerable people will be able to take up quickly the offer of a vaccine?
I don't know the particular situation around the two hubs that you're speaking about, and I try to have as much detail of what's going on across the country as possible, but I think people understand I don't know the situation in every single community hub across the country. Happy to get you more detail on that later on. Look, we're always going to have, so this is legitimate scrutiny whichever way it comes at us from, but if we're doing this in a way that is slower, we're going to get scrutinised rightly for that. If we organise the programme in a way that speeds it up, but perhaps compromises a little bit on local accessibility, we're going to get criticised for that. We have to find the best balance. That's what we're trying to do through the programme. Older, more vulnerable people being vaccinated in their GP practices as close to their own homes as possible, with the younger, more mobile groups in the population being directed to the bigger centres that might be a bit further away from home. Is it ever going to be perfect? Are we ever going to get that 100% right? There will be people who don't want to travel, who want to get vaccinated closer to home. It has to be as flexible as possible, but if we want, as we do, to get as many people vaccinated as quickly as possible, then these bigger vaccination centres are a critical part of doing this, and I'm afraid that is just the reality of the situation. On uptake, I'm not complacent about uptake when we go down the age groups, but let's, in a really grim situation, let's hold on to some positivity when we get it. The uptake in the groups we've vaccinated so far is way beyond anything I could dared have hoped for. If you told me a couple of weeks ago that we would vaccinate 98% of older care home residents, I wouldn't have believed you. That might have been more believable because of the nature of care homes. If you told me we'd be over 90% and over 80s, I absolutely would not have believed you. So that's a credit to those doing the vaccination, but actually it's a bigger signal of the willingness and enthusiasm of the public to come forward to be vaccinated. And I suspect we're going to see that right throughout the programme, because people want to be vaccinated against this horrible illness. We've got to make it as easy for people as possible, but if we want the throughput that allows us to do it as quickly as possible, those trade-offs between scale and local access are unavoidable, I'm afraid, and that's just a reality that I'm going to have to continue to explain to people. Do you want to add anything?
And I think the one final thing I've referred to earlier is about wastage. So every person we vaccinate contributes to saving a life, saving severe illness, and saving the ongoing long consequences of long COVID. So, as the First Minister says, it's a balance, but clearly we're going to monitor what this means for people, and we would expect local systems to be able to respond flexibly to that once they determine what the rate of uptake is and if it's just too impossible for people to reach these bigger centres.
Elsa Maishman from Scotland.
Thanks, First Minister. Military personnel have begun giving vaccines for the first time in Scotland today, which they've been doing in England for a while. So I wonder, is there any particular reason that this was brought in at this point? You and the Health Secretary have said before that the limiting factor in Scotland was supply. So I wonder, was it vaccinators as well, or is this a direct result of the letter sent by Alistair Jack? And secondly, just to follow up on an earlier question, you said some over 80s have been left behind, and that's to be expected in any large program. I've been in touch with a 100-year-old who's getting his vaccine on Sunday. He's one of several housebound over 80s in NHS Lothian that aren't getting their vaccine by the Friday deadline. I wonder if you're aware of a widespread issue across the country that those who are housebound tend to be getting their vaccine later, or if it's just a specific thing in NHS Lothian. And the daughter of this 100-year-old, she said she also used the words left behind. She feels like the Scottish Government kind of feels as though almost all over 80s is a good enough target to have reached, and her dad and the others who've been left behind don't seem to matter. I wonder what you'd say to her.
I didn't say earlier on, or if anybody took from this what I said, I'm sorry for that. I didn't say some 80s, over 80s will be left behind. I said in a big scale system, it will be the case that for a variety of reasons, small numbers of people might fall through the cracks, and for administrative reasons or something, which is why it's really important, if anybody is hearing of those cases, they do let us know so that we can find them. It wasn't a sense of, well, some over 80s will be left behind. That is not what I think is acceptable. We have vaccinated more than 90% of over 80s already. There is some completion of that ongoing. We will not get, the uptake rates are great, so I don't want to dismiss the possibility completely. It's very unlikely we're going to get to 100% uptake, but we will try to get as close to that as possible. So there will be some, sort of filling in the gaps of that. If a housebound over 80 has been vaccinated on Sunday rather than by Friday, I'm sorry, it's a couple of days. There will be local arrangements, no doubt, that have had to be put in place. I don't think it would be reasonable to say that as somebody being left behind, being vaccinated on Sunday rather than on Friday. But the uptake rates in over 80s is really, really high, and I think it is a good thing. But if there's anybody out there in that category who hasn't been vaccinated, if you haven't heard when you're being vaccinated, or if you've got a relative in that position, please, by all means, email me direct, and we will make sure that your local health board hasn't, for some reason, missed you out, and that you will be getting your vaccination. I had got an email from a gentleman this morning. I got lots of emails, but I just happened to see this one this morning. A gentleman in England whose mother lives up in the far north of Scotland, who had been vaccinated in her own home, I think yesterday, and full of praise for the logistical operation of getting people to, I think from the email, she lives in quite a remote part of the Highlands, and getting her vaccinated. So there's stories like that all over the country right now. They're good news stories, but anybody who, for whatever reason, they haven't had their appointment yet, make sure you get in touch so that we can make sure that you are vaccinated as quickly as possible. The military. We've used the support of the military in various ways over the course of the pandemic. They helped us with logistics for PPE. They helped us with logistics for the Louisa Jordan. They were based in this building for a significant part of last year, helping with logistical issues. So we use them when we feel we need them, but we don't want to overuse the military because they're under pressure like everybody else is right now. We made a request for some quite limited but important military assistance for the vaccination programme. I think the request actually, so it's got nothing to do with the letter from Alistair Jack. I think that letter came to me earlier this week. The request actually went in on the 23rd of January. It was agreed on the 29th of January. Military personnel, as part of that request, are starting work now. They're likely to be involved for quite a limited period, and they're involved in the logistics of some of the mass vaccination centre establishment and some very limited vaccination support as well. We are really grateful for that. The military's been helping all 4 nations of the UK. And, you know, a point I made yesterday, which is not intended to signal any lack of gratitude to the military. On the contrary, we're very grateful for their help. But, you know, Scottish taxpayers, like English, Welsh and Northern Irish taxpayers, you know, fund the military support. So it's not a favour being done to us by the UK government. It's part of the resource that we have a right to call on, just as other governments call on it as well. And the support they're giving us on vaccination, just as the support on the other issues I've mentioned, is hugely appreciated. And I want again today to thank mainly the Army, which has been involved for all of the help they've given us. Right, we are now at Tom Martin from the Daily Express.
Hi, thank you, First Minister. A couple of things, if I may. Alan Smith was asking about this earlier. It's related to the discussion at the COVID committee regarding the mid-February date for the over 70s and clinically vulnerable. Now, as part of that, there was quite a bit of discussion about people concerned at not hearing yet. Professor Leach, during the committee hearing, said people should be patient and wait until the 19th. So I just want to clear up, is it still the case that people should be getting their letters by this weekend? And at what point, if they haven't had a letter, should they be getting in touch to sort of raise concerns? And on this issue, you'll be aware of some of the problems people are saying their experience calling the vaccine helpline and getting referred back to NHS boards instead, being told that the helpline can't help in their case. So where should people be going if they want to query something?
I didn't hear the discussion at the COVID committee this morning, so I don't want to get too drawn into the specifics of that before I've had a chance to see exactly what Jason said. But we said the letters for the over 70 clinically vulnerable group will be out this week. Some health boards, I know, because I've had some emails telling me this and saying how grateful people are to. Some health boards have been texting people with appointments, or GPs practices perhaps texting with appointments. So there's a mixture of ways in which people are being notified of their appointments. Somebody in my own family in the over 80s group was telephoned and given an appointment. So there is a mixture of ways. If anybody is worried about not having received an appointment, there's a variety of ways. What we're trying to do, I appreciate the helpline is there for general advice. It can't give person-specific advice, although we are looking quickly to see whether we can hook the helpline up to the overall system so that it might be able to give more personalised advice. But you can contact your health board, you can contact your MSP. My office will immediately, no doubt, express their displeasure at what I'm about to say as soon as I go off at this stage. Email me if you want to, and we will look into it if you're worried about not having an appointment. But you will get an appointment. We're not going to miss people. Subject to what I said about, any big system, there'll be administrative glitches here and there, but we're not going to miss you. You're going to be vaccinated as part of this programme, so feel free to get in touch if you're worried that you might have been missed, and we'll be able to hopefully reassure you. And lastly, Tom Gordon from the Herald.
Thank you, First Minister. The UK Vaccine Minister Nadeem Zahawi was sounding pretty clueless on the radio this morning about the new managed quarantine system. Could you enlighten us a bit more and say at least which public bodies you expect to be involved in the management of this managed system? And going back to the weather, I know you mentioned gritters on the roads, but for many elderly people, their immediate concern is slipping just outside their house or on the pavement. And a lot of people will face a quandary this weekend about whether to go for the jag or, you know, possibly slip on the way and end up in hospital and get exposed to it, to the bug. For people facing that quandary, what is your advice? Should they perhaps defer and try again, or what's your advice to them?
On your first question, no, I'm not going to give more details today because we're working through those details and we'll set it out properly, hopefully in the course of the next week or so. Look, people should go and get vaccinated when they get a vaccine, but you know, if an older person in particular is worried because there are icy conditions and they don't have anybody who can perhaps help them or drive them to the vaccine appointment, contact your local health board. There will be an attempt to be as flexible as possible. I don't think it would be reasonable for me to give bespoke individual advice to everybody across the country. You know, people are sensible, but my overarching advice is we want you to get vaccinated. So you should go to your vaccine appointment, but if you're worried and you've got nobody else to turn to help you get there, you should contact your local health board, who will either be able to give you some advice on how to get to your appointment or reschedule your appointment to a time that it is better. So I hope that is helpful advice, even if it's not catering for everybody's individual circumstance. Do you want to add anything as a nurse to advise people in these circumstances?
I think the most important thing is just to stay safe, and people will know if they have slippy stairs to go down, they might not have the confidence. But I think this is probably now a time more than ever for communities to rally round and help, and you know, where there are streets or communities that know there are older people, then helping to move that snow. But if people don't feel safe to leave their house to go for their vaccination, they will be having another appointment. So people should not be worried and fretting about making that choice.
Okay, that concludes the questions for today. Thanks to all of the journalists, to Fiona for helping me, and for Rachel, for the BSL interpretation. Thank you to all of you for joining us today. Thanks for sticking to the stay-at-home advice. It is making a difference. I hope you can see today some signs, real signs of hope in the figures we're reporting. There's a way to go. We can't let up here or it will go in the wrong direction, but we should really take a lot of hope and encouragement from the figures that we're seeing right now, and we should also take some real hope and encouragement from the picking up on the pace of the vaccination programme as well. So let's stick with it. John Swinney will lead the briefing from here tomorrow. I'll be back with you on Monday at the usual time of 12:15, and in the meantime, please stay at home because we know it protects the NHS and it does save lives. Thank you very much indeed.